everyone.
Happy Wednesday. We're going to wait just a few minutes and let y'all join us.
If you're joining, say hi and tell us where you're watching from.
Lori's with us.
South Dakota. Who's all having great weather or not so great weather?
Adriana's with us from San Diego. Joan and Lee and Samantha. It's warm and sunny here today.
It is.
But a little breezy.
Super nice though.
It's a pretty good crowd.
All right, guys, we're going to go ahead and get started. So we have a special guest with us today. We have Dr. Stuart Pierce, and he is the owner and veterinarian at Kinetic Vet. And today we're going to discuss equine allergies, the skin issues, and respiratory issues.
If you have any questions, please put those in the comments. We'll get to them. And at the end of this segment, one lucky viewer is going to win a prize package from Kinetic Vet. And these products we're going to talk about today on the video. So be sure to get those questions in there or just tell us hello. And with that, Dr. Pierce, we're going to turn it over to you.
I appreciate the time. I appreciate Valley Vet for their support on our product line. A little bit history about Kinetic Vet. We're started about 20 years ago and owned by veterinarians. And one of the things that we identified about 5 or 10 years ago, about 7 years ago, is we identified the need for some dermatological products and skin issues and not only skin issues but respiratory issues. But so that's why we developed the EquiShield family of products. This time, it's the time of year now. It's the time of year everybody's dusting off their horses and, getting them out. And this time of year where the insects start coming out. So whether your horse is suffering from insect bite hypersensitivity, IBH, is prone to that, or any kind of atopic allergies or contact dermatitis or any type of allergies, this is the season that we need to really, if you're, in the northern half of the U.S. or, in Florida in the southern half, they, down in the warmer climates, they continually have a problem, but with insect bite hypersensitivity. But and then also we talk about, we're going to talk about some of the, like the heaves and the equine asthma and things like that. So, and I think we've got some products, not only the two products that you showed, the EquiShield SA and the IBH spray, but we've got, and that's the SA powder, and then this is the IBH spray. Those are really two great products to combat both the equine allergies and specifically IBH, and whether it's no-see-ums or it's any type of biting insect. So in short, we're a veterinarian owned and developed products, and we're based out of Lexington, Kentucky. So got a lot of products out there, and you guys carry 99.9% of them. So that being said,
We had a question from Donna, and she asked, how do you know what is just an allergy or if it's something else?
Well, one of the things that you've got to take, and a lot of times you consult your veterinarian if it's so bad. You know, there's dermatologists, that veterinary dermatologists that we take them, but a lot of time is an accurate history. You've got to have an accurate history of what is going on. Now, with the veterinarian, they'll come out and do a physical exam. So, do you have a, is it a, you know, trying to find out what the inciting cause of the episode, and that's kind of an open-ended question because it can be, is it a skin issue, is it a respiratory issue, is it a pneumonia, or is it something that that they've gotten into, or so proper history, and one of the things as a veterinarian, I would highly suggest they contact their local veterinarian.
Go ahead.
I'm just gonna move it up there.
There's one up a little further.
Farther?
Mm-hmm.
Right.
Who's right under?
What was it? Do you remember?
There, that one there.
She just said she has a horse that her belly will break out and she's rubbing it all the time.
Okay, let me get through these here. Donna says that she uses both the IBH spray and SA powder.
One of the people that I've saw this, and one of the people that I'm looking at the chats too, and one of the ladies said that she really enjoys the SA powder and the IBH spray. She loves all of our products, but the one product she hasn't tried yet is our sunscreen. And you guys have we've got an actual sunscreen that's available for horses as well.
Okay.
About.
There's one.
Christina said, I have a horse that the tear duct backs up on one side. They flush it, but this year didn't get it loose. The vet says it may be caused by allergies. Would that be something that would be a sign of allergies?
I mean, I haven't examined the horse or anything like that, but normally, I mean, when you think about that, you would think it would be it affects, it'd be bilateral or affect both eyes. So, I mean, surely there may be some allergy component to it, but that's kind of without really seeing the horse. It could be that, but normally, if there's an allergy component, it could be bilateral, both eyes affected.
Mm-hmm. Paige had asked, are there any contradictions to using Kinetic Vet products when a horse is also undergoing allergy shots?
No, not really. Okay, let's talk about there's a couple of topical products that got a corticosteroid in them, but the products that like the SA powder, for instance, that's an all natural product. It's got MSM and quercetin, and quercetin is the active ingredient. That's a bioflavonoid, and that means that it's a plant derivative that is a natural antihistamine. So when you feed that, you're going to get the effects of the quercetin as a naturally occurring antihistamine that's in nature, and that's the effectiveness of that.
All right. Rev asked, he said, my mare seems to get horrible hives from bugs. I assume mosquitoes at night. Can anything help her?
Well, there's one of the things that we And that goes into the combination of, as a veterinarian, number one, you got to identify, okay, is it mosquitoes? Okay, is that what the cause is? Okay, number two, we've got to control, and I'm talking specifically as a preventative too here, because you've got to put this whole package together. You've got to put the whole package together as far as relief for the horse. Number one, you need to control the population. Okay, where are they bothering her? Is she turned out? Is she stalled? Okay, we've got to try to do our best to remove the inciting cause. Okay, number one, control the. They've got some other products that you have that control the population of mosquitoes. Okay, that's one thing. Okay, now the next thing is going back to our products. The two products that you're featuring today that you're going to give away is the SA and the IBH. Okay, so those two products really, really, really work together internally. So you feed the SA powder. When the SA powder, that's kind of a 1-2 punch. You're feeding them internally. You're going to get a natural antihistamine, and then you're going to treat them externally with the IBH spray. And so what the IBH spray does is it's got the natural citronella that'll repel the insects, but also it's got the a little chlorhexidine for the skin health, but it also has a little hydrocortisone to take away some of the inflammation in some of the hives. So it's a 1-2 punch there, specifically along using those products and along with controlling of the insects and try to limit exposure. And I know that's tough, but it's got to be a whole package.
Joy says that she has a 22-year-old constantly tossing its head and rubbing his nose during the spring. Which product do you recommend?
I would start out with the SA powder. Okay, let's treat it systemically, that the SA. And you guys got it both in a 2-pound and a 12-pound available. That's what I would start. Now, again, this is a natural product, so you've got to give it a little bit of time to get within the system. Okay, let's get it in the system, and you need to give it a week to 2 weeks to get it into the bloodstream and get it. It's a supplement, so it's going to take some time.
Brandy said my gelding needs sunscreen. He gets burnt and wind burnt. Will the sunscreen work to protect for both?
Well, one of the things the sunscreen, it will protect with the UV rays. Okay, and I don't know about the wind burn, but like on the ball faces, on the the white faces, the star strip, snip, and things like that, they will use it on those areas. It's a zinc oxide. It's a zinc oxide formula, so it's a thing that's a barrier that protects it from the sun rays. It's a blocks it.
Okay. Laura says she has a mare that coughs a lot during this time of year when exercised.
Yeah.
We find that Zyrtec works well, but I wonder if it makes her a bit drowsy. Can you tell me what each of your products support, and if it's a supplement that you just use during allergy season or year round to help prevent?
You can do it year round. Specifically, you can use the product year round. We have some people that'll switch over, get off of it whenever we have a killing frost. One of the things that we find with that is it's starting to be really effective with heaves and hives and things like that. And I know one of the products that you carry that's in your pharmacy, that's prescription only, is an injectable antihistamine that we have on the market. It's called Recover. So the veterinarian has to give that's a triple enamine hydrochloride injectable antihistamine, but that's available through Valley Vet's pharmacy.
Okay. And Donna had asked, is there any prescription med that can be safely given to a horse daily with mild heaves that only flares up occasionally?
Well, the prescription meds, I mean, safely, there's, the corticosteroids, and everybody knows about the side effects of corticosteroids, you know, bronchodilators and things like that. One of the things that, and we've had a lot of people that have commented on the use of again, talking about the SA powder, about the effectiveness of reducing the cough for those horses that are on the SA powder. And again, there's also some prescription like injectables that we, like I just said, you guys have available. That's an injectable antihistamine.
Okay. Adriana is asking about a safe alternative to natural bug spray or pesticide feed through treatment. She is worried about giving toxic pesticides to her horse. She tried Equiderma, but she's allergic to the fragrance and citronella especially.
She's what about the citronella again?
I think allergic to the fragrance, what she says.
Well, that's kind of a tough one. I mean, we have a Fly Guard product. It's EquiShield FG Fly Guard, but it's a citronella base. It's got cedarwood oil and things like that. But if it's allergic to that, then I would really recommend staying away. One of the things too, and I know you're giving away that the spray, but we have it also in a salve, the IBH. You have it available in a 4-ounce salve, so you can treat those areas, whether, localized areas like on the ears and things, that just different areas.
Mandy said, I have a mare that gets large bumps from tick fly bites. Some seem to be permanent bumps after. I spray her frequently with good fly spray, and it's very effective on our other horses that are in the same pasture environment. Anything that will help.
Well, it's kind of the same lumps and bumps, allergies and things, but it's again, I sound like a broken record, but I mean, that's why we developed that SA powder, is just for that specific person that's calling in and saying, I need help. And I need help with the horse, and I need help with that.
Linda had asked, what is the name of the injectable antihistamine again?
It's Recover, RE-COVR, Recover. And it's, like I said, it's a prescription, FDA approved pharmaceutical, so it'd have to be a veterinary prescribed product.
There's one there.
Go up one more. This one or this one. Karen said she uses hyaluronic acid and MSM containing joint supplements. Will there be an issue with SA powder?
Well, it's got, MSM and sodium hyaluronate are safe, and at what levels, but I don't, and one of the things, you need to look at the ingredient panel and kind of compare. I hate it when, and hate it, but is we've got to see how many milligrams of each are going into them, and maybe you can eliminate some and add to it and things. Specifically, the SA's got MSM and HA in it as well, so maybe maybe you can eliminate one of the joint supplements over the allergy season time, and then in the winter or whatever, add it back in. But normally those products are very safe. The HA, the sodium hyaluronate, it's naturally occurring in the body,
Chris says that he has a picky eater. Is this easy to feed?
yes, yeah. We haven't. I mean, it's really palatable. It's really palatable, and I haven't had. I bet I can count on one hand how many, if I've had any complaints about the horses not eating product.
Someone asked what SA powder was because they missed it. So it's skin and allergy powder.
Gina says she has a mare with Cushing's and as a result has scratches on all four legs and skin rashes. Any product advice?
Well, one of the things that I was thinking about on that is, okay, what is the cause of the scratches? Okay, is it a bacterial infection? Okay, is it a fungal infection, or is it a contact dermatitis? Okay, so we've got to try to identify what the cause is. Okay, the other thing is I would, and again, we've talked about those few products, but again, you've got a full line of EcoShield like the CK salve. You have those. I know it's a chlorhexidine ketoconazole salve that you can put on those areas. We've got a CK. Specifically, it's bacterial or a fungal. We've got a CK spray. You've got the CK shampoos. So you can bathe them, shampoo the area, and make sure to rinse because of horses are so unique, and you've got to make sure to rinse the shampoos off thoroughly because horses aren't like dogs and other they're unique. So you can shampoo them with the CK, and then we've got a spray or a salve that you can put on there, and you can even bandage over the top of those products. So it's kind of you can kind of do a shotgun therapy on it with those products.
Elaine asked if the IBH spray repels flies or if you still need to use something else.
Yeah, it repels. It's the citronella. It'll repel them. I mean, a lot of times, yeah, to answer your question, it'll repel them for a certain time period. But that's the way with everything else. Everything else lasts.
I saw a comment on here that said, I wish I would have known about this live sooner. Make sure you sign up for our text messages. And they're always on our Facebook event page too. So.
And this video will be on our Facebook page. So if you need to go back and rewatch.
Yep.
Carissa had asked, she said she is using a Servo Equihaler and Ventapulmin. Any interactions with?
Now, one of the things you got, again, that it's not, these are natural, they're supplement type products. So there's no, like for instance, with the SA powder, there's no corticosteroids or any pharmaceutical type of you know, uh, ingredients.
Okay, Paulette asked about, let me get this out of the way here. Is it unusual? I'm sorry, it jumped off the screen. Is it unusual for hives to present at the base of the mane and then ooze blood and clear fluid along with it? Also, this happens to her entire tail. Would SA help this? I'm guessing it is a specific insect. It happens once a year for about 2 weeks. Only one horse of 4 is affected.
Sounds like to me it's like it could be a biting insect there, specifically at that location. One of the things, it just depends on the severity of it. You know, if it's really severe, you may have to, not only these products, but you may have to intervene with some more, you know, some more pharmaceutical type of products.
Joanna had asked if allergies typically get worse every year.
Sometimes they do, sometimes they don't. I mean, it just depends on the particular horse, and likely one of the things is depends on what the animal is susceptible to. It's no different than us, where we've got specific allergens that are more prone at a during an allergy season versus last year. So it's just kind of depending on if it's a bug, depending on the population of the animal and on that's affecting the animal.
And which ones are OTC?
Oh. Okay, so Jill asks, so is there an antihistamine in the products and are they all topical?
No, there's not any antihistamines. A lot of the products that we have are topical, like IBH. A lot of them, a lot of what we carry are topical because that's, as veterinarians, and we saw the need. We saw the need for equine specific dermatological products in the marketplace. So our focus and we've honed in on equine skin disease, and that's the EquiShield. That's the EquiShield line, and there's a few products that are internal, but there's a lot of them that are topical.
Jen says she has tried many products for ticks. They are excessive in Ohio. What are some of the elite proven products that you could recommend for tick control?
I mean, there's all kinds of EPA approved, you know, tick and spot-ons and sprays and things out that. Specifically, one of our products is we have a fly guard product that's a citronella cedarwood that seems really effective with reducing the tick population.
So Tina says that she has a mare going through allergy testing and treatment. I feel like it has been worse. Her allergies are respiratory, hard time breathing, and also coughs. Is this useful? Would it pass AQHA drug?
The one thing you need to check the different requirements. Okay, you've got to go to the different breed association, and you need to cross reference the ingredient panel to what they ban from that. So it's one of those deals where I can't back myself into a corner, and I don't know what each of it, you know, because there's so many governing bodies, whether it's FEI or USEF or the AQHA, and
All right. Donna asked, are there any breeds more prone to allergies than others?
Yeah, there's some, and I don't really know the specifics, but yes, there are specific breed predilections on them, on allergies.
Debbie asked, what is recommended for respiratory allergies?
Just the SA powder, and that seems to help. Seems to help them.
That's a long one.
It's a long
Yeah,
one.
yeah, I know that.
I don't
That's
know.
it.
What was the beginning? Ticks, was it?
Necessarily know.
She has fly allergies.
Oh, okay.
Fly
She-
bite. Yeah, that's really
Fly.
common.
Yeah.
And the fly, it's going back to it just to kind of, because a lot of people tuned in. You've got to, number one, what is the inciting cause of the insect bite hypersensitivity? Is it flies? Is it mosquitoes? Is it no-see-ums? Okay, identify that. We got to try to limit that. Then you need to remove them try to control them with the environment, and then the SA powder, and then the IBH. So it's a multifactorial. When you're dealing with these allergies, it's a multifactorial process that you have to do.
We had a few people ask which of these products are over the counter.
The majority of them, what you sell is over. You buy them and then sell them over the counter. They don't require a veterinary prescription. Now, the one product that we mentioned earlier, the injectable product, Recover, it requires an actual prescription.
Oops, sorry. Are these products just for horses?
There's some of them, like you look on your label. We intentionally labeled the products, but the SA powder and the IBH are specifically for that. But we have some other, like some of our EquiShield products will have a dog label to them. They'll have a dog species claim to them. We've actually got an SA soft chew for a quercetin for dogs too.
Any recommendations for horses that seem to have heave episodes more often when it is stress related?
That's kind of like me. So, one of the things, I mean, just the inciting cause is the heave episode. So whether it's an asthma or whatever, it's just, and the severity. I mean, there's some of them, and there's some horses that are so severe that it takes multiple things that you have to use. I mean, I have a lady that I've been working with, her and her veterinarian in Arizona, and one of the things that we're going through, and we're going through injections and the SA and just working with her and her veterinarian.
Diana says, today we're talking with Kinetic Vet about equine allergies and their products.
Do you have any premise products that you would
No.
it's mainly just for the animal?
Yeah, there's for the animal, and we just for the animal.
Any recommendations for clear eye discharge?
I mean, it's just, it goes back to what the physical exam. You need to know, is it a conjunctivitis? Is it an infection? Is it a tear duct problem? You just kind of got to dig into and do some investigation here first before you can throw a product at it.
And once we're done here, I will link the products into the comments that we're talking about, just so everybody can find them. There's been a couple
Okay.
links on there. So
Pauline did ask, how much SA powder do you use?
The dosage is 1 scoop, 30 grams per 1,100 pounds. And the 2 pound, I think the 2 pound is a 30-day supply, right at a 30-day supply.
you are correct.
All right. I think the questions slowed down a little here.
One of the questions I saw scroll through, and you didn't. One of the questions there, they ask about trihis granules and the difference between EquiShield SA, and the trihist is actually a pseudoephedrine, and it's an antihistamine and broncho, so in this, the SA powder doesn't have any of those pharmaceutical ingredients in there. No, let's see.
Just scrolling back through these. That one, Oh, Adriana had asked, what's the name of the IBH salve that you mentioned?
It's the IBH. I mean, it's just the spray, but it's also in the salve formulation. And we've got a little 4-ouncer. It's got the same ingredients as the spray, but it's really, really good for treating, localized areas and things under the belly and things like that.
There was one question about if the SA powder could take the place of an antihistamine powder that was prescribed.
I'm not going to, supersede the veterinarian there. One of the things that I like to work with is a veterinarian, and we have had, I mean, just depends on the severity. I mean, I've got one lady that'll do antihistamine injections, and she'll do SA powder, and then she's got to use sparingly some corticosteroids. That's how bad the horse is. And then there's others that are not so severe. So it's just kind of clinically, what are you seeing? And you got to work hand in hand with your veterinarian.
Linda had asked if there are any side effects with the Recover.
One of the things that it's an intramuscular injection. Do not give that product IV to horses. It's an intramuscular injection only. It doesn't have for instance, Benadryl and things have the side effects of being drowsy and those side effects, but this doesn't have those type of side effects. And again, it's only intramuscular to horses.
Samantha had asked cause of unilateral hives.
It just kind of depends on, to me, it's one of those things like the horse flies, whenever, if they're biting them on, on this side, that's kind of like the localized dermatitis where the wheals, the raised up areas. So it could be it sounds more like an insect component to it.
Karen just posted this question. My 22-year-old gelding has in the last 2 years shown circle pigmentation under his mane on his neck. Could that be allergy related?
It could be. Again, that's one of those deals where, you need to consult. I'm not going to sit here and make up answers. You better consult. You better consult with your veterinarian, and also there's board certified dermatologists. Where is she? Okay. Doesn't say.
Here's a question. If a horse is allergic to a specific weed, will it neutralize the toxin?
It's not the toxin, but so I think that she's talking about the SA powder. So what happens is if you ingest or you have an allergen of some sort that causes a reaction. Okay, the body's reaction is to release histamine. Okay, in an allergic type of event. So the histamine goes and circulates and attaches to the histamine receptors. Okay, and the histamine is released primarily through mast cells, through the white blood cells, and so it goes attaches to the histamine receptor. So what the antihistamine properties of the SA being a natural antihistamine is it decreases the attachment of the affecting or the offending allergen to the histamine receptor site. So that's the gist of an antihistamine, whether we take it or the animal has it. We give a product that occupies the receptor site, and so that allergic event gets you get through that allergic events, and the allergen gets expelled from the body. I hope that explained it as well as I could.
Harley asked, do you think that there is an allergy component to trigeminal
mediated head shaking?
Yeah, there
Yeah.
you go.
that?
I don't know. Some people think that there is. Some people think, the judge is out.
Is there a product that they can put on the spots after the fact that will help them go away, like from a bite?
Just depends on are they infected. That's what I mean. So the insect bite. Okay, so if it's an area that the animal has where it's a hive, for instance. Okay, you put on a product that would decrease the hives that would normally go out. Now, is there a bite component to where it gets infected? Okay, then that's a whole different beast. Okay, is it a bacterial infection, chlorhexidine? Is it a fungal infection? Superficially, that's the antifungal, like the ketoconazole or the azoles.
Okay. All right.
All right. Dr. Pierce, did you have anything else you wanted to add before we wrap up the segment?
No, I appreciate it. I appreciate all the questions, and I appreciate Valley Vet and their partnership and the successful partnership that we've had, and for you guys supplying great products to the animal health industry.
Okay. All right. I think we have a winner.
All right. We are going to draw a winner right now.
One lucky winner is going to receive one each of the EquiShield IBH spray
and the skin and allergy powder.
Who is our lucky
All right. Our winner is Judy Ryder.
Woohoo! Congratulations, Judy.
Congratulations, Judy. If you're still on here, go ahead and send us a private message and we will get the information we need.
Dr. Pierce, we want to thank you so much for joining us. We really appreciate you answering all these questions and talking with us today.
Yeah, thank you very much. I appreciate it. Have a good day.
You too.
All right,
Okay,
everybody.
just a few
Oh, gosh.
announcements before
Yes.
we let you go.
We'll let you go. A reminder, we still have our Spray Master Spectacular giveaway going on right now. It ends May 12th, so get entered so you don't forget. And we also have our Positively Awesome giveaway going on. That ends May 5th, so get entered in both of those so you do not forget.
Okay, and then join us next Thursday. We are going to be live again, but it will be on Thursday instead of Wednesday. We are going to be joined by our very own Dr. Lacey, and she will be talking about calf health. So you won't want to miss that. And that's all. So we'll
That's it.
see y'all next week.
Have
Thank
a great
you.
rest of your day.